and welcome to today's show, A Wee Bit Unfair. Today we're going to talk about diuretics, their mode of action, how they're abused in competitive sport, and also their unwanted side effects. Today we are joined by two familiar friends, Dr. Hoot and Dr. Spot. So, Dr. Hoot, you're a bit of an expert in this. Could you help guide us through what diuretics are?
Yes, of course I can. It's actually very simple. But before we can understand diuretics, we first need to understand the kidneys and how they function. So behind us here, we have a nephron, which is the basic structural and functional unit of the kidneys, which are our organs of waste removal. Over here is the glomerulus, and this can best be understood as a filter. The rest of these structures are like pipes, moving the filtered produce through the kidney and through diffusion in various pumps, add and lose the necessary molecules to maintain homeostasis and body requirements. Diffusion is basically nature's desire to establish and maintain balance. So, diuretics are drugs used to increase urination in order to remove excess water from the body. This is why they're known as water pills. There are 5 main types of diuretics, which each have a different mode of action that works on a different site on the nephron. So the first type of diuretic are carbonic anhydrase inhibitors, which work here in the proximal convoluted tubule. The second type are osmotic diuretics, which act on the descending loop of Henle. Next are loop diuretics, which act at the ascending loop of Henle. Then we have thiazide diuretics, which work on the distal convoluted tubules. And finally, we have got potassium-sparing diuretics, which block sodium channels in the collecting duct. Diuretics are used for the treatment of various medical conditions, such as hypertension, edema, liver disease, kidney disease, and as well to elevate electrolyte levels, particularly potassium and calcium.
Wow, that's a lot of information to absorb, and it's probably lost and wasted in this empty head of mine. So, I wonder why they're banned in sports. Could you tell me a bit about this, please, Spotty?
Well, they're used in sport for 2 reasons. Firstly, they're taken by athletes such as jockeys and boxers to lose weight quickly before an event so that they can compete in lower weight classes. Secondly, athletes who use other illegal performance-enhancing drugs often take diuretics to mask the presence of other banned substances. The 2 most abused substances are furosemide and hydrochlorothiazide. This is furosemide. It is a loop diuretic that inhibits water reabsorption by blocking the sodium-potassium chloride co-transporter in the loop of Henle.
That's a bit confusing to me, Dr. Spot. Could you make that a little bit simpler?
Sure. Try to imagine that you're sodium and you're wanting to go to the pub tonight.
That's something I can understand. So I'm sodium and I'm wanting to go to the pub. And the pub is outside the tubule and I'm walking along inside the tubule, right?
Exactly. So the co-transporter is basically your friend that opens the door for you when you arrive at the pub. Normally chloride would bind to the co-transporter, giving it the nudge to open the door and allowing sodium through. Furosemide prevents binding and thus the door stays shut. So you actually continue your journey through the nephron and then that higher concentration of sodium keeps water in the tubules and increasing water loss, meaning you're going to end up in the toilet tonight.
That's much easier for me to understand. Thanks, Spot. What's the second most abused diuretic?
Well, that one's called hydrochlorothiazide, which is a thiazide diuretic. It works in the distal convoluted tubules and reduces the reabsorption of electrolytes, resulting in increased excretion of water and electrolytes, including sodium, potassium, chloride, and magnesium. It's used in sports to flush out prohibited substances previously taken and achieve acute weight loss.
Okay, so diuretics are used in sport to lose weight so you can compete in a lower weight category than you normally would. Also to give you a competitive edge by using some substances which are prohibited. I understand now. Apparently there's an authority called the World Anti-Doping Agency, and they've just recently released a report on their findings. Dr. Hoot, could you please tell me a bit about this?
Certainly, Dr. T. They found that diuretics are the 3rd most used illegal drug after anabolic agents and stimulants. In 2013, they found 393 cases of athletes testing positive for diuretics, which made up 7.5% of all positive tests.
Wow, that is a lot of athletes taking drugs. What were the most prevalent countries of abuse?
Well, the Russians were the worst, followed by the Canadians and then Germany. It's pretty bad considering all of the terrible side effects they can have.
Terrible side effects? Tell me a bit about these terrible side effects.
Certainly, Dr. T. Well, the most significant one is dehydration, which can be life-threatening if it gets bad enough. This also causes dizziness, headaches, fatigue, seizures, convulsions, muscle weakness, and muscle cramps. It can also have a very negative effect on the body by causing hypertension and a loss of electrolytes such as potassium and calcium.
That sounds terrible, and thankfully we're not into drugs. Well, thanks guys. It's been a very informative session, and unfortunately that's all we have time for. So bye!